Hi, my name is Dr. Leo Polosajian, and my practice is in Northridge, California, as well as in Thousand Oaks, California. I also have privileges in Glendale. Today we'll be discussing about cardiac resynchronization therapy, or implantation of a biventricular pacemaker and a cardiac defibrillator. The indications of these devices to be implanted in individuals include the following: ejection fraction of less than 35%, or I should say less than or equal to 35%, a wide QRS, meaning a QRS duration of 120 milliseconds or greater, patients with a bundle branch block, patients with symptomatic congestive heart failure, and also a history of ischemic cardiomyopathy, which means a history of heart attack, or a viral cardiomyopathy, which means a history of viral disease causing the heart muscle to weaken. Therefore, it doesn't really matter if the patient has had a heart attack or not in regards to having the implant. However, what's important is the above that I just mentioned in regards to the ejection fraction being less than or equal to 35%, a wide QRS, and symptoms. Congestive heart failure affects approximately 5 million people, and it's a leading cause of death in regards to sudden cardiac death or from an arrhythmic death. In order to prevent this problem from occurring, we have devices that can be implemented or implanted in patients surgically, which may take approximately an hour and a half or 2 hours in length, and the patient is discharged home the next day. It's usually an outpatient procedure. However, the patient does stay 1 day in the hospital and under observation, that is, and the patient's discharged the next day. In regards to the procedure itself, the patient is brought to the cardiac operating room or into the electrophysiology laboratory under a sterile condition. The left deltopectoral groove is incised approximately 1 inch, and access to the vasculature is performed. Let me show you a picture of how this is performed, and we'll talk about this in detail. This is the heart when the patient does not have any leads. This is the right ventricle, and this is the right atrium. This is the right ventricle, it's the right atrium. Specifically, this is the left ventricle. What we do is we get access into the vessel that is near the clavicle, that's called the subclavian vessel, and through this we are able to feed electrodes or electrical wires, or leads we call them, into the bottom chamber of the right side, which is the right ventricle, then another one into the left ventricle through the coronary sinus. This is the wire that's going to resynchronize the heart when patients have a big boggy heart that's causing them to have dyssynchrony, and also for them to have symptoms of congestive heart failure. In addition to this, we would add another lead in the upper chamber in order to synchronize the atrium and the two ventricles together, and we connect the device to the leads and place it either underneath the muscle or underneath the skin. Once this is completed, the device is functioning immediately. And once the device functions immediately, the patient may start feeling better immediately, or it may take a little time for the muscle to start to get stronger in order for them to feel better. The risks and complications of a device implant like this include the possibility of infection, bleeding, trauma, death, heart attack, pneumothorax, hemothorax. However, in the experienced hand, the risks and complications are minimized, and they're approximately 1 to 2% in general. The patient stays in the hospital for 1 night, and the patient's discharged the next day, and will follow up in the office in order to check the device, the battery, the leads, and the connectivity of the leads. In regards to aftercare, the patient is advised not to lift the left arm if it's implanted on the left side, or maybe the right arm if it's implanted on the right side, for approximately 4 weeks. They are able to move their hands or arms back and forth when they're walking in order to prevent a frozen shoulder. In addition, we would provide them with antibiotics to prevent an infection, and we would also recommend for them not to wash the incised area for approximately 4 days to prevent any infection as well. Once it's completed and the follow-up is being performed, then the patient will need a routine follow-up every 3 months in order to check the device again as it was checked the first time, and we'll follow from there. Thank you.